Hi friends, it's Dr. Paul Jarrod Frank here at Frank MD, and it's early morning here in New York. In about an hour or so, we're going to get started with some advanced training in a new toy that we have here. I wanted to talk today about microneedling, specifically energy-based microneedling. Microneedling is a technique that's actually been around for many decades. It's not new. And the basics of microneedling is we can rejuvenate the skin by doing controlled trauma to it. We puncture the skin with very fine sterile needles, and we can improve various aspects of acne scars, texture, fine lines. But what's some of the latest and greatest advancements in microneedling is what's called energy-based microneedling, because we know technologies like radio frequency, ultrasound, amongst other things, they have worked to help stimulate collagen, tighten skin, improve quality, texture, and tone of the skin. So what's really great about the future of cosmetic dermatology is the combination of treatments. And this is a perfect example of some of this modern technology here. We know of technologies that have used energies from the outside of the skin. But what's unique about energy-based microneedling and what we're talking about is that these microneedles are actually injecting and delivering the energy directly under the skin surface. So it's all, instead of injecting Botox or injecting filler, we're actually injecting energy that will give a permanent biological shift in the skin to your benefit. What I love about energy-based microneedling is its versatility, its safety. We could really target any layer of the skin we want, from as little as very superficial, about a half a milli, down to several, 2.5 to 3 millimeters of the skin, where you'll find things like deep acne scars, where you'll get improvements in tightening of areas like the neck, which are very, very popular. People want to improve, or more superficial things like crepey skin, pores, even things like pigment. Now, one advantage over energy-based microneedling that a lot of the laser technologies that we love don't have is that it's really, it doesn't recognize color of the skin. We're not using a laser. So what's really great is that we could do darker skin tones. We could do people, we don't want to do people who are freshly tan, but we could do people that have color in their skin. And it's very safe for those patients who may have had complications, or they weren't a candidate before for a laser, or for some medical reason they can't do it. So it's a very versatile and safe device, and I've had many of them before. I've purchased and used many of them over the years. They've gotten better and better, but the latest and greatest of the ones that I love is the newer device I got called the Vivace, the Fractional Microneedling RF Vivace. And this is a great company. It's a very ergonomically easy device to use. It's portable, it's very solid state, and it's just a very user-friendly device with a lot of versatility. They have several types of needle tips. They're very, very small. I don't even know if you could see it. This robotic head will deliver it about once a second, all these little micro needles, and inject collagen-stimulating energy into the tissue. You can control the depth. You can control the amount of energy. You can control the length of the energy that's in the skin. So although it's simple to use, there is versatility in terms of what you can do with the device, because there's so many different things you can do with it. What's also great is that you can really control the downtime for patients and the pain. You really only need anywhere from 15 minutes to an hour, depending on how you're using it, for anesthesia. And you can really control the downtime to as little as few hours to several days for those patients who need more deep treatments, like deep acne scars, or older patients who need more tightening and lifting. But it's extremely versatile, and it also has built-in LED lights and energy to help combat inflammation, combat acne. So we really love this. It works quickly, it's safe, people find it comfortable, and you could really do just about anything with it. So for a lot of practices that don't have every device in the book, like Frank MD, this is kind of a jack of all trades that masters a lot of different things. Now, it is important to know it is still a medical device. It's a class 2 medical device. This cannot be used by estheticians. You can get pinpoint bleeding. In fact, for aggressive treatments, you want pinpoint bleeding that will last like an hour or so. So this is something that has to be performed by a medical professional, a physician, registered nurse, a PA. It's safe, but all things carry a small degree of risk. And if you want to see a difference, you have to accept that there are things that need to be done in an appropriate manner to ensure patient safety. So Vivace, radio frequency, energy-based microneedling. I love this new toy. We're going to do some advanced training, and hopefully you'll come visit us at Frank MD for one of our healthcare providers and try it out for yourself. We'll see you soon.